My name is Faith, and I represent the Seattle Department of Behavioral Health, and this is my TED Talk on opioid use in Seattle. Every 11 minutes, somewhere in the United States, an opioid overdose assumes the life of one of our own. These individuals aren't so different from you or I. These are our coworkers, our neighbors, our family, or our friends. Since 1997, this epidemic has been responsible for over 700,000 and counting deaths in the United States. Opioids are a classification of drugs which link with opioid receptors on nerve cells in both the body and the brain. These drugs are primarily used to combat pain in the nervous system and have proven to be highly addictive. While they produce a temporary pain relief of chronic pain, they also produce a state of euphoria, which is ultimately the cause of the misuse of these drugs. The cause for the widespread overprescription of opioids came in response to the World Health Organization's addressment of undertreatment of postoperative and cancer pain in 1986. As a result, the Joint Commission formulated policies for the treatment and management of chronic pain symptoms. These regulations mandated pain control for patients from physicians, and these physicians feared they would lose federal funding if they were not meeting the Joint Commission standards. Additionally, providers face increased pressure from pharmaceutical companies who ensured that only 1% of patients would become addicted to these opioids. Their falsified information, in addition to the pressure, was the largest contributor of opioid overprescription in the United States. In the beginning, the response to the regulated treatment for chronic pain was very positive. The demand for opioids was increasing, and the prevalence of chronic pain was decreasing. However, an individual's dependence to opioids often went unnoticed until it was too late, and abuse of these drugs saw a rapid increase. The increase was so rapid that in October of 2017, the opioid epidemic was deemed a public health emergency. The opioid epidemic is an extremely important issue of focus because it has resulted in overdose deaths becoming the leading cause of unintentional deaths in the United States. There has even been an increased use of opiates in the healthcare provider community. On average, there are around 175 Americans dying per day as a result of this epidemic. In addition, prescription opioid abuse leads to a plethora of other public health concerns. For example, people who become addicted to opiates often turn to using the illegal drug heroin. Heroin is a highly addictive drug that is also extremely sedative and holds a high risk for overdose. Further, heroin is usually injected intravenously, and because of this, diseases have been spreading rapidly through communities. Individuals who abuse opiates also have high risk of becoming homeless. About 65% of the homeless population in the United States is a result of drug abuse. It is because of the severity of this epidemic and the potential for a multitude of other public health crises that public health officials are beginning to take action. Every state in the United States has seen a drastic increase in opioid morbidity and mortality, but the most vulnerable populations are those in rural areas. Majority of opioid abuse occurs in the population aged 16 to 40. This population is vulnerable to the many risk factors associated with drug use. The first drug use risk factor occurs at the macro level and includes social stressors such as economic inequity and deprivation, as well as systemic discrimination and other environmental stressors. The next risk factor is a local context, and this includes family dynamics, family composition, stress, peer environment, and pressures from peers and family. Finally, endogenous factors can be a risk for drug abuse. This includes genetic predisposition, personal characteristics such as risk-seeking behavior and impulsivity, as well as gender and age. Unintentional deaths from opioid use increased by around 30% in the years 2016 to 2017 in 45 states. Urban areas are seeing a 50% increase in unintentional deaths, while rural areas are seeing astronomical increases of unintentional death of nearly 400%. The opioid epidemic is steadily affecting various communities day by day, and death rates are rapidly increasing all over. The community of focus is Seattle, Washington, or King County, and this is an urban area that has seen a 300% increase in opioid-related deaths from the years 2013 to 2016. Opioid dependence in the United States is increasing by the year at rapid rates. Rural areas see the worst of the prevalence in overdose deaths, but when urban communities begin seeing prevalence that increases in rates which compare to those of rural areas, intervention needs to take place. Seattle houses 730,400 residents with a relatively diverse population in which 66.3% residents are white, 7.7% African American, 0.6% American Indian or Alaskan, 13.7% Asian, 0.4% Native Hawaiian, and 0.2% in the other category. Seattle has a relatively high median household income of over $83,000, which is 41% more than the national average of just upwards of $59,000. The unemployment rate is significantly lower than the national average of 4%, hitting a 2.9%. Because of these, Seattle's relatively high population of people living in poverty, 11.5%, is very concerning. Seattle faces a multitude of health disparities. Some of these issues include wealth inequity, a contrast in life expectancy between wealthy and impoverished areas, and social factors. From these disparities comes a plethora of other public health issues. Seattle varies in their comparisons with national statistics on ongoing public health concerns. One relatively new public health concern in Seattle is opioid dependence and abuse. Seattle has had a steep increase in opioid-related deaths, tripling from 49 in 2009 to 156 in 2014. These rates are continuing to rise as they have reached 348 in 2016 and grew to 379 in 2017. Seattle's opioid-related deaths have increased in prevalence every single year for the last 7 years. One of the most significant ways to prevent the substance abuse epidemic from spreading rapidly is to create an intervention that educates the public on every aspect of the issue. However, Seattle faces a multitude of barriers that contribute to the exponentially developing opioid epidemic. For example, communities which suffer from substance abuse epidemics are communities that more than likely suffer from health inequities, and as previously discussed, health inequity is one of the largest problems in Seattle. It is also notable to include that other major public health issue Seattle faces is homelessness, and typically 65% of the homeless population suffers from substance abuse. Homelessness, along with addiction, is among one of the most prominent health issues facing Seattle, and these can be significantly linked with health inequities. As a result of these inequities, these communities suffer from a slower rate of development, and they also suffer from minimal to no education on these important public health issues. Further, the community suffers from lack of funding for improved facilities and resources. Because of this, the Seattle Department of Behavioral Health is hoping to formulate an intervention which would focus on healthy and safe alternatives to medicines for mental health issues and educating the public on the biggest risks and potential outcomes of addictive substances. As previously stated, one of the largest contributors to the opioid addiction and overdose is lack of education. The first step of the intervention is simply educating on the topic. This lack of education includes not knowing exactly what opioids are, as well as not knowing the effects they have on the body. It is important that the population knows what opioids are, the services that are available to them, and how to combat addiction. The intervention program seeks to hold public seminars based around the Substance Abuse and Mental Health and Services Administration, or SAMHSA, strategies for individuals on what opioids are, the dangers of opioid dependence, and current trends and statistics regarding this epidemic in Seattle and the United States. The seminar will also give complete information on how to be connected with a recovery program, and even provide the option for free enrollment into the programs following the seminar. These seminars will be mandatory for individuals with low-level offenses, and they will be held by the Seattle Department of Public Health, and the incentive is freeing them of their offenses. Further, due to the rising deaths from opioid overdose, SAMHSA formulated a risk assessment that includes educational programs that teach strategies and interventions for preventing overdose deaths on the provider end. The program will do so by working with providers from clinics, departments, and practices to implement the SAMHSA strategies of up-to-date prescription practice, alternatives to combat withdrawal, and alternatives to pain treatment. Further, providers will be required to use the state prescription drug monitoring programs, or PDMPs. These programs use databases that track the quantity of prescriptions, limit the number of pills per prescription, and ensure that a patient is unable to access multiple prescriptions from multiple providers. SAMHSA offers completely free of cost education for providers that help improve treatment and practices for opioid addiction and abuse. The program intends to promote the utilization of SAMHSA fully funded education to providers via financial and certification incentives. The final strategy is to implement a mobile needle syringe exchange program, or MNSEP, which will help to provide accessibility to those vulnerable populations. While doing so, the program intends to partner with local law enforcement to decriminalize the low-level drug offenses and provide no penalty to individuals utilizing the service. This will help the community be more willing to utilize the mobile needle exchange and prevent the spread of disease in the community, while simultaneously linking these individuals with services if they are ready to take that next step. The program does not intend to promote abstinence, as previous studies show that it is an ineffective method of intervention. In a review of evidence-based interventions, harm reduction or damage control was one of the interventions which saw the best outcome in combating the epidemic, and that is what the department intends to do. In order for this program to be successful, partnerships are inevitable. This program intends to partner with law enforcement, health department officials, and community activists. This program will elect officials for regulation and will run for 5 years to determine whether the program can run effectively and reduce the negative impact of the opioid epidemic within the community of Seattle. Overall, the program intends to promote evidence-based interventions which educate providers and individuals about prescription methods, dangers of opioid use, and how safely to promote alternative treatments. Policymakers of Seattle have become a catalyst in the rising rates of opioid abuse and deaths in their city. As previously discussed, Seattle has partnered with members of their community to formulate policies which decriminalize the use and abuse of drugs amongst their citizens. While doing my research, I discovered that Seattle law enforcement has created their own program titled Law Enforcement Assisted Diversion, or LEAD, which allows individuals with low-level drug offenses to be referred to community support services rather than serving jail time or being charged with citation fines that they simply cannot pay. This program is an alliance between law enforcement, public health officials, hospitals, and treatment centers, and community groups, and a variety of services to vulnerable populations. In addition to the drug treatment programs, these services include housing, healthcare, and job preparation. LEAD works with a multitude of employers around the Seattle-King County metro area to provide job offerings to people in recovery. This type of program from law enforcement in a community is so important for establishing trust and making advancements within the opioid epidemic, because law enforcement often serve as barriers for progressive health interventions regarding opioids. Another large stakeholder in treatment service is the Community Public Health Department. The public health departments hold a partnership with the Washington State Division of Alcohol and Substance Abuse to provide publicly funded treatment services to those in need. The DASA successfully created a treatment program system available to the entire state to aid in the distribution of alcohol and substance recovery programs. This program requires a county to establish an alcohol and substance abuse and addiction board, an election of a substance abuse disorder treatment program coordinator, and a 10% match of funding from any local public or private source to receive funding from the state. These requirements could be a huge barrier for certain areas with low funding, religious and cultural biases, or any general area where substance abuse intervention programs are lacking. Nonetheless, the Seattle Substance Abuse Disorder Treatment Program effectively provides these services at little to no cost through PH departments or treatment agencies which hold partnerships with the public health departments. Seattle also offers a variety of community groups and treatment centers available to substance users. Seattle offers treatment programs for specific cultures, such as Native Indians, veterans, religious programs, inpatient hospital programs, inpatient rehabilitation programs, and many outpatient services. These diverse associations assist in accessibility and cultural barriers. Overall, though Seattle has already implemented various policies to aid in the improvement of the opioid crisis, more intervention is needed. The educational program, which provides accessibility to the history and science of opioids and the epidemic caused by them for both vulnerable populations providers, allows for a greater portion of the population to see positive changes in the epidemic. Additionally, the Seattle Department of Behavioral Health, partnering with law enforcement and continuing to implement the LEAD program, is an exceptionally progressive step toward improving the rates of opioid dependence and overdose deaths, and the intervention program, partnering with law enforcement, helps feed even more individuals into the intervention program. Finally, the mobile needle syringe exchange program will serve as a method to prevent the spread of disease, provide accessible services to those who are unable to travel, help prevent unsafe disposal of paraphernalia, help link individuals with the intervention program, help the vulnerable population with access to materials used for overdose reversal, and overall potentially decrease the rates of opioid overdose deaths in Seattle. Thank you for coming to my TED Talk.